Today we will know what is the monitoring system following an open heart surgery. You will have seen many monitors in your general surgery, OTs, general surgery ICUs, medical ICUs, surgical ICUs, neuro ICU, intensive care ICUs. There is a monitor in cardiothoracic surgery, intensive care unit also. It is called CT ICU. Apart from regular things, what we see in the CT ICU monitors are any patient following any open cardiac surgery. This is the heart rate which you commonly see. And this is the saturation which is commonly seen, pulse oxy, in the ward also. This one is called invasive arterial blood pressure monitoring. This is called invasive central venous pressure monitoring. And continuously we'll be recording the patient's respiratory rate also. So how many are there? 1, 2, 3, 4, 5. And there's another thing. Though it is not coming in a form of a wave, in a form of a number it is coming. This is nothing but the pulse rate. You see the heart rate is 76, but pulse rate is 74. A regular difference up to 5 to 10 is acceptable between the heart rate and the pulse rate. If it is beyond 5, then it is abnormal. We'll discuss why it is so later part. This is the ECG. Depending upon the R wave, the heart rate is calculated. Depending on the how many R waves are there, that the machine will calculate the heart rate. And depending upon the amplitude of this wave, the saturation of the patient is detected. The amplitude depends upon many factors. This one is very much unique for a cardiothoracic ICU system monitoring. This is a arterial blood pressure trace which is showing the systole, the diastole and the mean arterial pressure. In a non-invasive blood pressure monitoring, where we have here also, that will be displayed here, NIBP, it is monitored at the rate of 5 minutes or 2 minutes or 3 minutes in interval. But in continuous invasive arterial blood pressure, the blood pressure of the patient is monitored every second or every fraction of second continuously, so that any abnormality we can immediately act upon. That is the reason. Another unique feature of a post-cardiac surgery patient is the central venous pressure monitoring. What is the normal is 0 to 4. If it is high, there is maybe a cardiac tapnet or cardiac failure. If it is low, the patient may be in volume deficit. These are the two important monitoring systems which we have. Here now you can see there is one ECG abnormality you have seen now. The ECG was, trace was disappearing, the arterial trace was also disappearing. That indicates an ectopy. In this monitor, we know whether the ectopies are there or not. If there are ectopies, they are really ectopies or not also we can study. So these are the 1, 2, 3, 4, 5 and 6. The 7th one will be the NIBP monitor. A patient, if he is kept on ventilator, we can even record ETCO2 in the same monitor. So these are the features or the variables which we have to monitor post cardiac surgery. Thank you.